Got someone's phone up here. Just checking that's recording. Is it? Okay? Very good. Well, kia ora koutou katoa. Welcome again to the Ministry of Health to the update today. So for a fourth consecutive day, there are no additional confirmed or probable cases of COVID-19 to report in New Zealand. As you know, to date we've had 5 confirmed cases based on positive laboratory testing and the 2 probable cases. One patient, one of our confirmed cases, was discharged home from Auckland City Hospital yesterday and is under the care of their GP now. As we announced yesterday, the woman who was being cared for as a probable case in North Shore Hospital, who had been on that cruise on the Grand Princess from the 11th to the 21st of February, is also now at home and in the care of her GP. In both cases, public health staff remain in daily contact with both people and their families. The family members, of course, relevant family members, will continue to be in self-isolation as close contacts for the balance of that 14-day period. Of the other confirmed cases, none is requiring hospital care at this point. All the close contacts of the confirmed cases have been contacted by public health staff. They are also checked in on daily to see whether they have any symptoms. Of course, if they develop symptoms, then they also know to call either public health staff or Healthline. So, in terms of what we can do in New Zealand, fundamental to our efforts is not putting yourself or others at risk if you are unwell. Not going to work or being out in public if you are sick. All of us have a role to play in stopping further spread, and I need to emphasise how critical this is to New Zealand's overall COVID-19 response. I know that all of us probably are guilty at times of, if we've got a bit of a runny nose or a bit of a sore throat, we might go to work because it's not too bad, or we might, if our child's slightly unwell, send them to school. This is the time when we've got to be much, much more strict with ourselves and with our families around this. It will be, as I say, a mainstay of our efforts to address this major issue. And it's particularly important for large gatherings, concerts, and other mass gatherings, some of which are coming up this weekend, like the Pacifica Festival in Auckland and the commemoration service down in Christchurch on Sunday to mark the year since the terrorist attacks on the mosques in Christchurch. Please stay home if you are unwell and watch them on TV or enjoy doing something else. Now is the time for us to be even more vigilant, and of course those other basic public health messages around hand washing and good cough and sneeze etiquette are imperative. Going back to the person who had been admitted earlier to North Shore Hospital after she returned from her cruise, the first of the staff who had been stood down and asked to self-isolate are back at work today, and the others will continue to return to work. All will be back at work by next Monday if they remain well. As I said yesterday, no impact on clinical care of the patients there from the stand downs, and all services continue to be provided as usual. In terms of testing, we have the 5 confirmed cases. As you know, the 2 probable cases where the test results were negative, but the clinical picture and travel history were such that they were treated as probable cases, and 331 negative cases. Today, as every day, there is a number of tests being run around the country in the labs. Healthline continues to take a large number of calls. Yesterday was 2,930. That's double what the call number was at the same time last year. So, as you well know, they have stepped up the number of staff there. And they have also, in addition to the incoming calls, have got 9,039 people or households who have registered to be in self-isolation since the process began. And 2,145 of those registered people remain in self-isolation. And I just want to thank all those people who are in or who have been in self-isolation, whether they are confirmed cases, whether they are close contacts of confirmed cases or probable cases, or just people who have returned to New Zealand from overseas from those countries of concern. Self-isolation is one of the most important tools that we have to address the COVID-19 outbreak. And again, it is inconvenient. It does require people to really change what they're doing, and I just want to thank those many individuals and families who have done this, and it will remain a very important part of our response. So I'm going to stop there, and I'm very happy to take questions.
This morning a flight landed in Auckland from Vancouver, and we understand that health staff boarded it and wearing protective clothing and took the family off the plane. Can you tell us what happened there?
No, I'm sorry, I don't have any further information about that, but I'll be happy to look into that.
Sorry, your staff told us that you would be answering these questions at the press conference. So.
Right, I don't have any information about that. I actually have just come from briefing the Minister, and I had a short period of time to prepare, but I'll very happily look into that and we can provide further information on that.
Thank you.
Mm-hmm. Have you been sending any tests to Australia?
No, we haven't been sending any tests to Australia since when we first stood up the testing here at the ESR laboratory in Wellington. For the first few tests, we were having them sort of checked by sending them samples to Melbourne, but we haven't been doing that for some weeks.
So you're confident that the test results coming back as negative here are correct?
Yes, very confident, and we're using the same assay and the PCR test as being used in Australia and in other laboratories around the world.
You said that all the close contacts have been traced and are in isolation now, but have you continued getting those wider contacts, and have you employed extra people to trace those numbers?
So the additional contacts being the casual contacts, we've used a range of ways to reach out to those casual contacts, including Healthline, but also in the case of, for example, those who might have been on aircraft. The Air New Zealand call centre, with some oversight and training from Healthline staff, has done those outbound calls. I can say that it's very unusual for us to get every single casual contact. You can imagine if it was a mass gathering like a concert. However, what the evidence suggests is that to be successful in containment, you need to get at least 80% of those casual contacts, and we have been able to do that in all cases with the cases both confirmed and probable that we've had to date. Please.
So what is the specific standard for New Zealand to lift the travel ban to other countries? So
Yes.
New Zealand will consider imposing a ban on Italy?
So at the moment we have in our category 1A for travel restrictions is just China and Iran, and that's been looked at on a daily basis and being reviewed by ministers at Cabinet each week. At the moment in category 1B, which is people can travel from those places but they must go into 14 days self-isolation. So we have the north of Italy there at the moment, and we also have South Korea. We've got additional advice just yesterday from our technical advisory group about whether we should be adding other areas or jurisdictions, and that's being considered later today by the special CBD Cabinet Committee. What I can say about the countries, particularly China and Iran, where there are those travel and border restrictions, that they will be next considered at Cabinet on Monday.
Is New Zealand being proactive enough in terms of social distancing measures, given the pattern of cases that we've seen overseas?
I think we are, and this is why you heard me leading out very strongly. Of course, the best way to social distance is not to go out or expose other people to your germs if you're unwell. One of the other things we're doing this week is looking at specific settings where people might be at risk, and one of those is aged residential care, and we've seen in a couple of jurisdictions what happens if you get the virus in that setting. So I've asked for a message to go out to all aged residential care facilities to say that they should now have very clear notices saying if you are unwell, please don't visit, and don't visit until you have been well for 48 hours. And also, even when visitors do come, that they can practice effective social distancing. So at the moment, even though we don't have evidence of any wider community spread and the small number of cases, we need to preempt it and also start to get used to social distancing.
How long do you think we will need to keep this management up in terms of the public health space to, manage the potential spread of coronavirus within New Zealand? Is it a year long? Is it a few months?
We've got to stay the course here. It's going to be at least a few months, and the objective here is you might have seen some of the graphics, is to sort of flatten the curve and elongate it as much as possible, because then we can ensure that both the impacts on the health system and the broader economy are lower, and also that we can manage it over a longer period of time. So the way I'm thinking about this stamp it out phase is really it's a long stamp it out and slow it down phase. Because we know from the evidence we've got and learnt over the last month or two the characteristics of this virus and the effective actions that some jurisdictions have taken, like Singapore, even South Korea as we watch that, Taiwan and China itself, that they can, even where they've got quite widespread outbreaks, they can actually contain it. And this is what Italy, of course, is trying to do now. Our job is to avoid getting to the position that Italy is in the first place.
When do we move from the stamp it out phase? At what point does it flick over into the next level up?
Yes, so we're thinking about it quite differently because we see this virus has got some important differences from a flu virus, which is what is behind the pandemic plan. And the way I would think about it, again, in that longer stamp it out and slow it down phase, is we use a whole range of approaches for that, and some of which normally we wouldn't necessarily use until we got to a manage it phase, like the mass gatherings, schools closing and so on. Those are things that we should have all those things in our toolbox to deploy decisively now if we need to maintain that ability to slow it down.
There's been a couple of media reports over the last couple of days, one about Northland's first potential coronavirus case being tested. Have the results of that come back?
Yes, that result was negative.
And then if we look, there was also one from staff about a Northland man who went to the Tool concert. I'm unclear if they're the same person, but they were unwell and, say, in isolation. Have they been tested and is that back?
They've been tested. My understanding is the results back today, but I do want to comment on that situation. That was and just commend exactly what those people did. And if you read the story, they did all the right things, and the health service then did all the right things, so lessened the risk to other people. And the people who are now being tested are self-isolated, and we'll wait and see if the symptoms that they had are from COVID-19.
Are you aware of the different areas in New Zealand that currently have tests under examination?
No, I'm not aware of every one, because I do know today there are 28 tests being done around the country in different labs, and DHBs or primary care practitioners will send those to whichever is the nearest lab that does testing.
Okay, and I think just lastly for me, there is a story running that is about McDonald's preventing people bringing their keep cups in for use. Should we be wary of keep cups carrying coronavirus?
Well, I think that what I would say, and I have a keep cup myself, is you shouldn't be going out with your keep cup if you're symptomatic. And so the main thing is if you've got your keep cup and you're going out for a coffee, then we'll assume you're well. This comes back to if you're not well, you're not going to be using your keep cup because you'll be at home.
Are you able to talk at all to how likely it is to spread in an office? We've seen Vodafone telling 1,200 workers to stay at home as part of a pandemic plan. Internet New Zealand and Wellington is doing the same thing. They're trying to get themselves ready for a situation where they may have to tell all of their staff to stay at home. Is it that likely to be able to spread in an office if someone went to work sick?
It's a really good question, and what I would point to is the evidence we do know is that close contacts we define as within a metre for more than 15 minutes, and also that evidence from China that most transmission was happening in the family setting, so within the close confines of the family home with, sort of sharing the same house and so on. I think what Vodafone and others are doing, and it's happening across government as well, is testing their plans for how you keep your business going if we have to deploy much more significant measures, and or if you do have a case. And I just commend both private and public sector organisations that are doing that and rehearsing it at the moment.
Is the ministry looking, at virtual reality technologies if it was to proceed for GPs to use?
For what purpose?
For instead of consulting with patients on one-to-one, but using virtual reality technology.
So what we're looking at is for every district health board to have a plan that complements what their primary care practices are doing to ensure that anyone with symptoms can be swabbed, and if a practice can't do it. So let me give an example. When we had the swine flu outbreak in 2009, in one area of the country, in Christchurch, they set up a community-based assessment centre. So anyone with symptoms went there. It's the so-called fever clinics. But in other areas of the country, for example, more rural areas, often what will happen is that one practice will be dedicated, will decide to be dedicated just to doing testing and assessing people, and another practice, general practice, might take people with all other conditions, regardless of which practice people are enrolled with. What I think we will see, and I know there are GPs already thinking about this, is yes, them using technology much more to do consultations, so phone or Skype, or video consultations. I think that's a really good idea. And it's a very good way of also just keeping in touch with people who might be in self-isolation, either because they have got the disease or because they are in self-isolation as a close contact.
We've seen members of the public buying up a range of products to protect themselves against COVID-19. How effective are things like wet wipes or sanitising wipes?
So the two most useful things are hand sanitizer and soap. Soap probably first of all. The other thing is, rather than wet wipes, and I think there was a really good article by Susie Wiles, who's the microbiologist, a few days ago about how to properly kind of disinfect a surface. And the point she made there was you spray on the disinfectant, and anything with generally a low solution of chlorine, a low proportion of chlorine is effective, but you've got to leave it on for 10 seconds before you wipe it off. And so I would just use general not detergents, cleansers. Wet wipes probably not quite so effective. Last question, perhaps.
We've seen some international reports that some hospitals are running out of respirators.
Yes, respirator masks. Yeah, the N95 masks, yes.
Is that likely to happen here in New Zealand as well, or what's the situation?
Well, one thing I can say is we've got 9 million of them in our pandemic stock, as well as the 9 million normal surgical masks. And that's in addition to the stocks that district health boards would already have on hand. So I'm quite confident for our population we've got a really good stock of these, and it's pleasing to be in that position. Look, thank you very much. Again, I appreciate your interest and ongoing support for our efforts.
Thank you.